Hypertension. Do you know that every third adult in the world today is living with high blood pressure and most of them don't even know it? Hypertension is called the silent killer because it quietly damages your heart, kidneys, and brain for years without showing a single symptom. In today's video, we'll understand what hypertension really is, how it affects your body, and how you can control it naturally through lifestyle and diet. What is hypertension? Hypertension means persistent elevation of blood pressure in the arteries. Normal blood pressure is around 120/80ths of a millimeter of mercury, but when it stays above 140/90ths of a millimeter of mercury, it's considered high. Blood pressure is measured in two numbers: the systolic pressure, when the heart pumps blood, and the diastolic pressure, when the heart relaxes. When these pressures stay high over time, the arteries become stiffer and narrower, forcing your heart to work harder. Over years, this leads to heart failure, stroke, and kidney damage. Types and risk factors. There are two major types of hypertension. 1. Primary, essential, hypertension, occurs without a single clear cause, linked to genetics, age, and lifestyle. 2. Secondary hypertension, caused by another medical condition such as kidney disease, thyroid disorder, or certain medications. Major risk factors include high salt intake, obesity, lack of exercise, stress, poor sleep, smoking and alcohol, family history, insulin resistance and diabetes. According to the World Health Organization, 2023, more than 1.2 billion people globally suffer from hypertension, and nearly half of them remain undiagnosed. What happens inside the body? When blood pressure remains high for a long time, several dangerous things happen inside your body. The endothelial lining of arteries gets damaged. Plaques start forming, leading to atherosclerosis. The heart muscles thicken, left ventricular hypertrophy, due to extra workload. The kidneys suffer from nephropathy as small vessels inside get destroyed. It can also rupture brain vessels causing stroke or paralysis. This is why doctors call hypertension a gateway disease. It opens the door to multiple cardiovascular and metabolic problems. Symptoms. Here's the tricky part. Most people with hypertension feel completely normal. Some may experience mild symptoms like headache, dizziness, blurred vision, chest pain or shortness of breath, but usually, these appear only when blood pressure is dangerously high. That's why regular checkups are essential. Hypertension often hides silently for years. Prevention and natural management. The best part is, in most cases, hypertension can be prevented or controlled without heavy medication, just through lifestyle changes. Here's what research recommends. Diet. Dietary approaches to stop hypertension, rich in fruits, vegetables, whole grains, and low-fat dairy. Limit salt to under 5 grams per day, about 1 teaspoon. Exercise. 30 to 45 minutes of moderate activity, walking, cycling, swimming, 5 days a week. Avoid smoking and limit alcohol, both directly raise blood pressure. Stress management. Yoga, meditation, and deep breathing have proven effects in lowering BP. Regular monitoring. Early detection saves lives. Treatment. When lifestyle isn't enough, doctors prescribe medications like ACE inhibitors, e.g., enalapril, beta blockers, calcium channel blockers, diuretics. But remember, these should always be taken under medical supervision. Never stop medicines suddenly, as that can cause rebound hypertension. Conclusion. Hypertension doesn't kill overnight, it works slowly, silently, and powerfully. But with awareness, early screening, and healthy habits, you can control it before it controls you. If you found this video useful, don't forget to like, share, and subscribe.